Welcome to my YouTube channel. In this video we will talk about flu, influenza. So before going to the video, make sure to hit the like, comment and subscribe button so you don't miss any update from us. What is the flu, influenza? The flu is an illness you get from the influenza virus. It causes symptoms like head and body aches, sore throat, fever and respiratory symptoms, which can be severe. Flu is most common in winter months, when many people can get sick at once, an epidemic. When is flu season? Flu season, when cases of the flu go up dramatically, in the Northern Hemisphere, which includes the US, is October through May. The highest number of cases, peak, usually happen between December and February. How common is the flu? The flu is one of the most common infectious diseases. Every flu season, about 20 to 40 million people in the US catch the flu. What is the difference between the flu and the common cold? The flu and the common cold can have similar symptoms, like runny nose and cough. But cold symptoms are usually mild and flu symptoms can be severe and lead to serious complications. Different viruses cause colds and the flu. How do I know if I have the flu or COVID-19? Since they have similar symptoms, the only way to know for sure if you have the flu or COVID-19 is to get tested. They both have a risk of serious illness. But different viruses cause these infections, and providers treat them with different medications. Who is at higher risk for complications from the flu? Certain health conditions can put you at higher risk for severe illness from the flu. This includes life-threatening complications that require hospitalization. You're at higher risk for serious illness if you 1. Have asthma, COPD or another chronic lung disease. 2. Have a history of kidney, liver, neurological, heart or blood vessels disease, including stroke. 3. Have a condition that causes issues with muscle function or makes it difficult to cough, swallow or clear fluids from your airways. 4. Have diabetes. 5. Have a weakened immune system, from HIV, AIDS, cancer or immunosuppressive medications. 6. Have a blood disorder, like sickle cell disease. 7. Have a BMI greater than 40, have obesity. 8. Are under 5 years old or over 65 years old. 9. Are pregnant. 10. Are under 19 years old and take aspirin regularly. 11. Live in a long-term care facility. Symptoms of the flu usually come on quickly, and can include 1. Fever. 2. Chills. 3. Body aches. 4. Cough. 5. Headache. 6. Sore throat. 7. Runny or stuffy nose, congestion. 8. Tiredness or feeling run down. 9. Diarrhea or vomiting, usually only in kids. You may not have all of these symptoms. What causes the flu? The influenza virus causes flu. Influenza A, B and C are the most common types that infect people. Influenza A and B are seasonal. Most people get them in the winter, and have more severe symptoms. Influenza C doesn't cause severe symptoms and it's not seasonal. The number of cases stays about the same throughout the year. 1. What medications treat the flu? 2. Antiviral drugs for influenza include 3. Oseltamivir phosphate, Tamiflu. 4. You take oseltamivir by mouth as a pill or a liquid. You usually take it for several days. Zanamivir, Relenza. You breathe zanamivir in through your mouth with an inhaler. 1. You usually have to take it for several days. 2. Zanamivir isn't recommended for people with breathing issues, like asthma or COPD. 3. Peramivir, Rapivap. 4. Your provider gives you peramivir directly into your veins using an IV. 5. You usually only need 1 dose of peramivir. 6. Baloxavir marboxil, Xofluza. You take baloxavir marboxil by mouth as a pill or a liquid. You only take 1 dose. Baloxavir isn't recommended if you're pregnant, breastfeeding, chest feeding, hospitalized or have certain medical conditions. How can I prevent the flu? The best way to prevent the flu is to get the flu vaccine every year. Vaccines train your immune system to recognize infections and fight them off before you get sick. The influenza virus can change, mutate, a little bit every year, which is why you need to get vaccinated every year. Other ways to reduce your risk of getting the flu include: wash your hands often with soap and water. If you aren't able to use soap and water, use an alcohol-based hand sanitizer. Cover your nose and mouth when you sneeze or cough. Cough or sneeze into your elbow or a tissue rather than your bare hand. Avoid being around other people when you or they are sick with the flu or other infectious diseases. Consider wearing a mask if you're sick and can't avoid being around others. Avoid touching your face, eyes, nose and mouth. Don't share food or eating utensils, forks, spoons, cups, with others. Thanks for watching the video. Make sure to hit the like, comment and subscribe button so you don't miss any update from us.